Welcome to another Topic Tuesday. This is Dr. Mike McCall, Source Health Center. I want to talk about a subject that's near and dear to my heart. It more than likely built my practice, meaning that it helped me build my practice, and it's one thing I check on all my patients pretty much every time I see them, because I see it having such a far range effect on their health, not only on what they're coming in with, but just their health in general. I don't know if you guys know this or not, if you're my patient, I adjust your bones and I love it. It's a foundation to my care. But I'm also looking for other things that I think, based on what I find, that I want to check, not only because it's going to help you, but I do know that if I can take as much pressure off your body as much as I can, teach you how not to put the pressure back, then you're going to be healthy. And if you get really healthy, I won't ever meet you again. Which is fine, because there's a lot of sick people out there. You just tell the world, that it worked out for you. So one of the most common things I've done is Ileocecal Valve, and a lot of you guys know it because I talk about popcorn and chocolate so much, and we've talked about that piece. I really want to focus on why Ileocecal Valve. So applied kinesiology, which is the form of muscle testing that I do, when a patient puts their hands right here on this lower part, just kind of between the belly button and their hip bone, it's the point right over the appendix, and the appendix is right next to the valve, which is the ileocecal valve. It's a valve between your large and small intestine. So the small intestine comes in this way, and it comes in at a right angle into the colon. And the small intestine's job is to basically get the nutrients it needs and be able to keep the stuff out that it needs to keep out, and it goes in the large intestine. And the large intestine, what it does is it catches any more molecules, any more minerals, like especially sodium and potassium, and we don't want to lose those minerals. And at that time, there's a lot of minerals in there, especially potassium. It wants to reclaim those again, but also wants to dehydrate that, because everything from the small intestine that goes in the large intestine is pretty much just liquid. So the large intestine just dries the materials and get it ready for elimination. But what's interesting is this valve here is very sensitive to so many other parts of your health. It's sensitive to the hormones, it's sensitive to your autonomic nervous system, so your fight and flight and your rest and digest, your parasympathetic and your sympathetic. And the reason why I look for it so much as a chiropractor is it is one of the most tremendous causes, meaning that it contributes to many people's pains and discomfort, especially when they wake up and they first experience their symptom that they came in with. So many times if you came to see me, I go, oh, did you wake up with that pain? Or was it a specific event? If it's I woke up with it or I slept funny, I always look for this. And one of the reasons why is it has a tremendous effect on how the fluid in your body is distributed. If this is an active point, it tends to make things more murky, means that your lymphatic system gets congested a little bit, and the lymphatic system needs motion. If it doesn't get motion and there's a problem with the lymphatic and it's associated with why a patient comes in, I look for this because it is the cause of causing the chemical irritation to the musculoskeletal problem. One of the things that I've kind of come to say repeatedly to myself and my patients is many times a musculoskeletal problem isn't because of something from physics, meaning that there isn't some kind of force, or I'm sitting funny, or something's being pulled or sheared, like physical things. Your musculoskeletal pain many times can be from a chemical side, meaning inflammation, high hormones, too little hormones, not enough sodium, not enough potassium. The musculoskeletal system is very sensitive to many things. In fact, all the innervation to the nervous system, meaning that when they discover kind of a new type of nerve, they find many times the musculoskeletal system, the muscle system, is innervated by it or affected by it. So if there's any irritation in the gut, many times you won't feel it because it takes a lot of abuse in the gut before you have symptoms that would drive you to the doctor. Many times what I have found is if there is a digestive issue, sometimes it may show up in the joint because the joints need flow. They need fluid in and fluid out. They don't like having stasis. So for an ileocecal valve, many times I test this way. One of the most important muscles that helps make the low back secure is your psoas and iliacus muscles, which are the ones that basically fold you over. So when people go, it hurts when I bend forward, I look for these muscles. So if they're weak, then I usually have the patient TL here. And now at this point, I'm asking the body, do I need to fix this? And if it makes this muscle strong, which it does for Maddie, I have ileocecal valve. So many times I have to work these points from Chinese medicine, hit these reflex points to get it going. But overall, what I'm trying to tell you is, I look for this a lot. If you're a patient, that's usually what I'm looking for. Many times it'll come back, and what it does in a chiropractic practice, based on my patient base, where I am and how I see things, it makes pain come back, especially in the mornings, feels better as you get going, or it shows up as a chronic sciatic pain, meaning that you may have a confirmed distal MRI. And by the way, if you're 45 years old, you get an MRI, 100% of the time they have shown you will show something on an MRI. Doesn't mean that that's the problem, could be contributing to it. You don't know what until you find out. So what I try to do is look at the things that you can't see on the MRI that may be able to contribute or make it better. And many times it's the ileocecal valve. So popcorn and chocolate can make this work. If you think you may have ileocecal valve, then here's your checklist. Do you feel pain in the morning, feels better as you get going in any joint in the body, especially low back, especially sciatic? You have to exercise or you start to have pain. That could be ileocecal valve. PMS that's off the charts, you might have ileocecal valve. Headaches in the morning, chronic headaches, you want to look at ileocecal valve. Chronic sinus problems, you can't quite get rid of it, it keeps coming back, ileocecal valve. And the reason for it is, once again, you have the fluid gets congested in the body and it causes irritation. Now, we're at a point now in medicine where we're realizing many different things, but one of the biggest things is the first problem for any kind of disease, dysfunction, syndrome, or any kind of diagnosis is inflammation. As soon as you have inflammation, you start to have some type of problem. Ileocecal valve contributes to the inflammation because what it does is it causes the inflammation to stay in that area and not allow the body to basically off-gas it or drain it away. That's why it's so important, and that's why most people feel it when they're not moving. So this is what I use for every chronic low back pain, even though chiropractic by itself is helped, because chiropractic works so dang good. But if it's not working, there's usually something else in the body that's holding a chiropractic adjustment back. By finding this, eliminating it, many times it helps a lot of problems, because when the fluid doesn't flow, health will go. And we'll see you next Tuesday.